Back in October, I was with some friends. It was a business thing, and we were walking to a restaurant, or actually back from. But my group that I was with was trying to get there faster than I could, and I knew that my knees had given me problems for years. I knew I was going to have trouble, so I was trying to keep slow, but it was a long, long hike, longer than I had expected. And by the end of it, I was hurting. My knees were not happy. And over time, over the next couple of months, they were actually getting worse. And they started popping, painfully popping. Sometimes I would almost fall. The knees were hurting so bad. And I decided, okay, this is not getting better. I thought about going to my doctor and remembered what he told me last time was, cortisone shot which didn't work the last time, and or surgery. And I don't like to do that unless I absolutely have to. So I decided I will talk to Jaron and see what happens, see if chiropractic might help. That was my first preferred step. So I came to Jaron, and he started doing some adjustments, and we've been working on it, and they were getting better slowly, getting better, and the popping stopped. I was really happy with that. And I was able to go to bed at night and not have my knees hurt. And then a couple of weeks ago, I was putting in some flooring on my craft room floor, and I was just sitting there at this side, and I turned this way, and my left knee just excruciating pain. And so I got into Jaron as soon as I could, and I come to the office hobbling with my cane just so I can get here. And on my way out the door, I'm walking just normal, carrying my cane, thinking, I feel like Fred Astaire, do a little tap dance here. So, and so everything was fine after that, back to where I was before, and walking. He gave me some, instructions and some things to do, and I've been working on those. And then last Sunday, just a few days ago, my right knee decided to be upset and mad at me, so I get into Jaron, and once again, using my cane to get here, he puts me back in. It's so awesome. I can walk as I'm leaving this place. It's very exciting. I'm very, very, very pleased that I'm not going to my doctor and waiting for a cortisone shot to work. Oh, give it time, they say. And, last time that I gave it 6 months and it didn't work. So, I'm happy with my chiropractor. When you're trying to put on a sock and you cannot bend your knee far enough to be able to reach your foot, and you have to get your husband to come and help you put your socks on, that's really slows down your life. When you're trying to sit down or stand up, and you've got to figure out a way to get the weight off of the knees so that you can actually not fall into a chair or not fall. Just getting into a tub was an exercise in physics. You had to figure out how to get that leg up and over the side without it being excruciating. It was rough. It was really hard. There would be times when I do a lot on the computer, and just sitting there, the knees would be aching as I would just sit at the computer. You try to get up and walk around. Walking was difficult. I was using a cane just to get as much pressure off the knees as possible. If I was standing for a long period of time, my thighs would start going numb. I couldn't go shop. In fact, at the stores, I would be the one in the handicap cart because I couldn't do a lot of walking around. It just wasn't possible. My knees originally started acting up about 31 years ago. And I was pregnant at the time, and they would grind, and I actually was unable to straighten out. Of course, it was my right knee. I was unable to straighten it out, and the doctor was telling me surgery, and they couldn't do it till after the pregnancy. By the end of the pregnancy, I was walking around just normal and fine, no pain, no problems, and that's when I started to wonder just how much do doctors really know, and just how much surgery is really being performed that didn't need to. If I hadn't been pregnant, I would have had surgery. Once you cut, you can't go back and say, oops, I didn't want to do that. Can we just erase that? It doesn't happen. So I always look first for non-invasive solutions. It's definitely better now, and as we keep working, because I'm not going to quit just yet, I want to keep getting better and better and build up more strength in those knees. I want them to be in a better condition, and I need to lose some weight, and I'm going to work on that. But between the two, I think we'll be... I want to be able to play with my grandkids more.